Hi, you guys. Welcome back for our daily practice questions. It's day 9, but y'all know first I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. I have maintained a 99% pass rate on all of my courses and a 100% pass rate on my one on one sessions. Now, y'all, I don't know if I have said thank you on the video. I know I did a post, but I have spoken with so many people, so I'm just going to say it again if y'all have already heard it from me. But thank you, thank you, thank you. I don't know if y'all remember, but I did a post for the best MP board prep nominations last year, right? And y'all showed up and showed out, and the Nursing Studio won Best MP Board Prep for 2024 in MP Student Magazine. Y'all, I am so excited. Many of y'all have been around for a while. Some of y'all are new to me, and I just want to say thank you. I appreciate all of the nominations. I appreciate all of the testimonials. They mean more to me than you know, because I have been at this thing for 10 years just off of the strength of what I wish I had when I was preparing for boards. And I have designed and created various things to help y'all and to meet you where you are, but also meet the changes in guidelines, the changes in test structure, the changes in how things are provided in a university level. I get it. I've been there, and I always said once I got past boards, I was going to provide people with the things that I wish I had. So to be not only nominated, but to win, oh Lord, y'all don't know what that means to me. But thank you, thank you, thank you. And yeah, I'm just overwhelmed with excitement from all of that and all of y'all's congratulations and feedback. Y'all, it means more to me than you know. But okay, I'll get off of my rant. But thank y'all, thank y'all, thank y'all. But y'all know my disclaimer before I get into the question is that we know there's no absolutes in medicine. We treat on a patient by patient basis. And any of the questions that you see here, I've designed and created based on the current guidelines that are being tested on the ANCC as well as AANP. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1. Question number 1 states, which of the following is the most likely diagnosis when when AV nicking is observed on retinal exam? Is it A, diabetic retinopathy, B, hypertensive retinopathy, C, glaucoma, or D, macular degeneration? Take a moment and tell me what you got, you guys. All right, you guys. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. Stem of the question typically being that very last sentence of the full scenario, the one with the question mark. But here in this case, the stem is the question is the stem, right? So it states, which of the following is the most likely diagnosis when AV nicking is observed on a retinal exam? So it is typically most commonly associated with B, right? Hypertensive retinopathy. And I'll get into that a little bit more. But yes, hypertensive retinopathy. Question number 2. What is the underlying mechanism responsible for AV nicking in the context of hypertensive retinopathy? Is it A, retinal ischemia due to high intraocular pressure? Is it B, thickening of the retinal artery while leading to compression of the vein? Is it C, fluid leakage from the retina? Is it D, increased retinal blood flow causing venous dilation? Which one do y'all think? Tell me in the comments. All right, same thing. Stem is the question. The question is the stem. What is the underlying mechanism responsible for AV nicking in the context of hypertensive retinopathy? And your best answer is B, y'all. So what happened is, I'm going to read it to you and then I'm going to explain it to you, okay? So thickening of the retinal artery wall is leading to compression of the vein, right? And you're probably like, Yeah, I know what those words mean, but what does that mean, Brittany? So, all right, A/B nicking. And I'm somebody that I go down the rabbit hole and I'm going to explain that thing because that's how I have to study. Because you know how you know stuff, but there's so many different things that we have to know that unless you truly understand that why, it's difficult to retain. So I'm a person that's going to go all the way down and then I'm going to break it down to the least common denominator and then I'm going to come up with a way to make it stick, right? But anyway, the eye stuff is not something that we do all the time. So I think that's also what makes it a little bit differently. So let me try to explain it in a way that I think that we know from our basic medical knowledge, right? So with AV nicking, what's going on is because of uncontrolled hypertension, just like any other vessels, the vasculature in your body, when we have uncontrolled hypertension for prolonged periods of time, the vessels become damaged, right? Because what's going on with uncontrolled hypertension, those blood vessels are having to provide more force, right? So anytime we do more force, what happens? It becomes to be damaged. And so now these vessels are inflamed, so they're much more narrow. I'm about to butcher that word, but it's much more narrow, right? So that's the same thing that is happening in the vessels of the eye. When you have hypertensive retinopathy, you're beginning to have damage to that retinal, the retinal vessels, right? So that thickening that we're talking about in this answer here is coming from that constant force from uncontrolled blood pressure damaging the retinal walls. So the vessels are now thickened, inflamed, so they're much more narrow. And with that, it's causing the compression of the veins. So that's why they call it AV nicking because the appearance looks like the arteries are nicking the veins. Make sense? I hope that makes sense. I hope that helps. But that's why when we think of a lot of eye issues, hypertension, diabetes are the classic two, but hypertension is the top of the top in almost all of our eye issues. Hypertensive retinopathy, classic, classic, classic. So I hope that kind of breaks that down for you. And then when you look at it, you'll see these little tiny vessels, but one looks like it's crossing the other and it'll slightly like it's nicked. And that's that AV nicking. Okay. In my book, I have pictures of it for the eye section just because also, like I say, I have to break things down to the least common denominator. So I encourage y'all, if y'all don't have the book, to Google these things when you're studying, right? Or get the book, whichever works best. But I say when you're studying these things, go through it, know it. So I put it in a chart for you like this. AV nicking. Then I give you a picture of it because I need you to know the term, see it. Now let me explain it, right? And so then I break it down the same way. Secondary to prolonged uncontrolled hypertension, right? And we talk about how the vessels are. So just make a note of it, make a chart or whatever you need to do. But I need you to not only just study the term, knowing what it is, go look at an image so you can see it. And trust me, it will help you to tie it all together. And then how you treat it, right? So that leads us to question number 3. What is the most appropriate first-line treatment for a patient with hypertensive retinopathy and AV nicking? Is it A, laser therapy, B, antihypertensive medications, C, diabetes management, or D, observation and follow-up? What do y'all think? Tell me in the comments. Tell me in the comments. All right. So same thing here. The stem is the question is the stem, right? So what is the most appropriate first-line treatment for a patient with hypertensive retinopathy and AV nicking? Y'all, you got to treat the source. Treat the problem, right? Correct the problem. We're not trying to pacify nothing. We're treating the problem. If that uncontrolled hypertension is tearing these vessels up, which is messing up this retinal walls, which is leading to the AV nicking, we need to handle this hypertension, right? So you're going to prescribe your antihypertensive medications. Of course, you're going to monitor it, do the lifestyle modifications, and try to get that hypertension under control because it's damaging not only the vessels in the eyes, but all throughout the body, increasing their risk for cardiac issues and more, right? So treat the source, antihypertensive medications. All right, you guys, as always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. I thank you you guys for all of the subscribers, everybody that shares. Um, Y'all, that helps me tremendously. It spreads it to more people. It makes it more visible. But that is the thank you to me when I'm doing these videos. I appreciate you guys so much. And if you need any other resources that I do offer, as always, feel free to reach out to the Nursing Studio. You can give us a call at 803-400-6864 or shoot a text message to this number or shoot us an email to the Nursing Studio, the number one at gmail.com. All of the things that I do offer are linked in the bio of this channel, including my website. But if you're looking to book any of the one-on-one sessions or any of my custom packages, I always say either call, text, or email so that I can speak with you to gauge what you truly need. But as always, y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.